Okay, welcome everyone, and thank you for joining this briefing on the humanitarian situation in Gaza and famine. We would try to keep it around 1 hour. I will give my colleague Amjad Shawa. I will introduce him first. Amjad, for those who do not know him, Amjad is the director of Pingo. He's now based in Gaza City. He's been working with Pingo since 1999 and has, I would say, interacted and led humanitarian work for many years inside the Gaza Strip. He is the foremost resource on knowledge on the humanitarian situation. Currently, he's coordinating the work of national, international, and UN organizations to provide humanitarian relief in the Gaza Strip. Amjad, the ground is yours.
Thank you, Ubay, and hi everyone, and thanks for your participation in this event. I don't know from where to start talking about Gaza, although that I know that you are receiving so many reports and you could see so many issues related to Gaza, the deterioration with full meaning in all aspects of the lives of the Palestinians. But the situation is really warning regarding the humanitarian conditions. And as mentioned by Ubay, the issue of famine. But let me start about what happened today. Today, early morning, three sites were attacked by Israeli jet fighters. Three families entirely razed from the records in Beit Lahia, in Jabalia, in Mawasi. These areas where the Israeli directed the people to go by the forcible displacement orders. Mawasi is full of tents and sites. Tens of thousands of people are based there, seeking safety. Although it's not safe, there is no place is safe in Gaza. In Jabalia, which was totally destroyed, and the people of Jabalia are staying over the rubbles of their homes or on different sites, established their tents. Very complicated situation. Most of the people were killed, more than 70% this morning, were children. Infants, and there is a pregnant woman also killed with her baby, still not born. These children who were killed, they were malnutrition. These children lost all the opportunities in very difficult situation that all the children in Gaza are suffering from. Today it's 1.5 months, 45 days of the Israel closure of the crossings. There is no entry of anything to Gaza Strip, whether food items, medicine. Almost we have nothing as humanitarian aid agencies, nothing in the warehouses. And this is by UNRWA, by WFP, the big agencies, and also by the national NGOs. And if in the market, I think you are following the food security sector updates about the prices. Some items 1,000 times expensive than before. And there is absence and deficit of the basic items for children, for women. And we are talking, when I talk about malnutrition, simply what is available between our hands. It's only some rice, some lettuce that we can distribute through the tikiyas or the community kitchens that we are operating in the 30% of the Gaza Strip, which is still the Israelis are not forcibly displaced these areas. So 70% almost is empty of the Gaza population. Although that I can tell you that still some people are staying in Beit Hanun, although it's forcibly displaced. In Shija'iyya, in Rafah, in some areas. But the majority of the people are staying in the 30%. In each corner in Gaza Strip road, there is some kind of tents. I can't say there is tents. There is deficit of tens of thousands of tents, which is the need for displaced people. According to OCHA, from the 18th of March till now, there is about 450,000 displaced, newly displaced people, or have a new round of displacement. But this time it's the most difficult time of displacement. I'm also the chairman of Atfarana Society, the building of Atfarana, which was for deaf children, which was destroyed. So I was in a visit to the Atfarana building, which was destroyed. I could find about 50 families who moved from Beit Hanun to stay over the rubbles of Atfarana Society. So I went there and I said, do welcome them. And I asked them if they need anything. You know, there is, when you're displaced, you need latrines, you need something, you need food, you need basic things. So we tried our best to offer something for them. And when, you know, this is very complicated because just beside the building, there is a mountain of solid waste. And according to municipality of Gaza, there is in Gaza only, in Gaza city, 190,000 tons of solid waste, which is in the streets and the roads and in the neighborhoods, beside the sites. And I could find some tents over these dumps of solid waste. How people are living, I'm one of these people. The issue is not you have money or not you have. There is nothing to buy from the market. If there is something, the only thing that you can manage to think how to survive. Water, finally, Makarot line fixed and they started to pump some water. But already we have problems regarding that desalination plant, which is based on the evacuated areas. Most of these water wells, also these facilities, which desalination plant, which is in need for fuel and spare parts. So I'm not talking about the quality of water. If it's good for clean, for a drink or not. It's a big issue. So here we are talking about very complicated situation. The complication it came that if we're talking about malnutrition amongst children, I cannot separate the issue, food issue from water from the issue of health. I paid a visit yesterday to the Baptist hospital, the Arabic Ahli hospital, and they could see the destruction, the attack which destroyed the main hospital, which, you know, hundreds of surgeries every month, happen about 500, 600 surgeries, big surgeries. About hundreds of cases they are dealing with every day, whether they are wounded or patients. Now it's out of service, which really give hundreds of questions. It's not only related to the humanitarian situation, about the future of Gazans. So there is the intention to affect the lives of the Palestinians through this kind of strikes, and in the same time, the issue of the closure of crossings. The mental health is another big issue. After we have ceasefire, hope is to the maximum that this will continue. This is the only thing that kept us alive, the hope. Losing the hope is something really catastrophic, mainly amongst children and women. We are in the worst humanitarian conditions since the early beginning of this war, or from 1967 till now. We never, ever, in the worst nightmares, could imagine that this happened, not only in Gaza, in any context. That we all, as a humanitarian actors, paralyzed towards this. And we feel this frustration also from the international community towards what's going on. No one can understand. Yes, I could see some concerns here and there, but actions are in need, because malnutrition will have impact, severe impact, on the health of these children for ages. They could be paralyzed mentally, physically. 610,000 of the children are denied to have the fourth dose of polio vaccine. On such pollution that we have, I think you can imagine what will happen. Also, the other vaccines. Personally, I'm afraid to go to hospital. For the chronic patients, there is no medicines, and daily we are receiving so many calls from these patients for calling for their medicines. So there is severe deterioration on the health conditions for these cases, and we are talking about tens of thousands of chronic patients. But about cancer patients, we have 11,000 patients who are in bad need for medical treatment. According to Minister of Health, there is zero stock on the health items. So the main thing that we are concerned that in 1 week, the community kitchens will be closed. No more meals to deliver. Already that the meals, according to food security sector, we have 1 million meals for about 48% of the population. In 1 week, nothing to give. Finally, I have to stress that CAT's announcement yesterday about the new plan, which is kind of organization of aid. It's serious. And already talks by UN agencies and the Israeli side about this plan, to have kind of distribution hubs on the south of Gaza, not in the north, which means first that they will make new displacement orders for the people from Gaza north to the south. B, controlling the aid, quantity, quality, items by security measures. And they will be vetting on the communities, also on the agencies who will work. whether it's through any actor, the military companies or whatever. This is very risky and in the same time a grave violation to the humanitarian principle. We do welcome the statement of the Secretary General and his commitment of these principles, and we working with the UN agencies in order to have this commitment amongst all the organizations. And also one of the serious things that is kind of exclusion for the UN, for the UNRWA, for the national NGOs, for the majority of the international organizations, for the private sectors. So they will deny any entry for the private sector goods. It's very serious and it will have severe implications. And this kind of unprecedented step will have implications and serious consequences, not only on the Palestinian level, in Gaza level, it will be worldwide. So we hope that donors, the states, to have real position, not to deal with this. Yes, they are using our suffering, this genocide, in order to apply their plans, nothing to accept, only the respect and the commitment of the humanitarian principles and to reopening all the crossings to enter the needs of Gaza. There is thousands of trucks loads waiting on the border to enter, and part of it, which is food items. And we have concerns that part of it damaged due to the weather, to the expired date, and there is medicine. So your pressure to end these catastrophic conditions is highly needed. We urge you as soon as possible how much you can do on that in order to pressure Israel, at least to respect the humanitarian international law, the humanitarian standards, and to end such attacks on the Palestinian civilians. This is the issue of protection, which is a priority for the Palestinians. And I can tell you, the Palestinians in Gaza and the North refused this displacement again to the North, and I'm one of them. I was displaced for 15 months, and I managed to come back 2 months ago with my family, and we insist nowhere to go, just to stay here, whatever the conditions are. It's really appreciated, and very happy if you have some comments and questions. Thank you.
Thank you, Amjad, for this. It's really important what you said. I will now move and talk about the famine declaration by Pingo last week, where the situation now is, or the call for the UN to declare famine and the Palestinian government, where the situation even has deteriorated since last week. And I want just to bear with me with this short presentation. Okay, so this is a short presentation on the food security crisis in Gaza, famine and genocide, understanding the crisis and exploring also the effective responses. How does the IPC declare famine? The situation of household food security. This is just a layout of the presentation. Situation of malnutrition among children, non-trauma related deaths, and I will end it with required intervention. Famine declaration by the IPC. The IPC is the Integrated Food Security Analysis. This defines famine as a situation in which at least 1 in 5 households has an extreme lack of food and face starvation and destitution. resulting in extremely critical levels of acute malnutrition and death. So IPC famine is phase 5, that at least 20% of the households facing an extreme food shortage, 30% of children have acute malnutrition, and for every 10,000 individuals, 2 adults or 4 children die for non-trauma related death. So people would ask now, why hasn't the IPC declared famine? And we have been receiving this kind of questions from everyone. The IPC relies and depends on its ability to measure these variables through access by relevant agencies. And access to the Gaza Strip has been severely hampered. Access to the Gaza Strip, I would just want to quote the spokesperson of the UN Secretary General, which has emphasized, under international humanitarian law, if the whole or part of the population of an occupied territory is inadequately supplied, the occupying power shall agree to relief schemes on behalf of the said population and shall facilitate them by all means at its disposal. This is reflected by a number of Security Council resolutions, including Resolution 2713, 2024, and 2417, 2018, which strongly condemn the unlawful denial of humanitarian access and depriving civilians of objects indispensable to their survival. In this context, and this statement was made on April 13th. In this context, to understand that UN agencies are not having adequate access, there is not adequate access for international agencies, and we all know also that access for even local organizations have been severely hampered by the Israeli targeting of Palestinians, including also Palestinians that are working in humanitarian sector. For the number of households facing extreme food shortage, this is also main sources from the UN. Humanitarian aid is the primary food source for 80% of the households across all governments. This is according to OCHA, a date on the April 15th. If you calculate this number, it's 1.68 million people. So the other 20%, it's also an important food source, but they have also other sources, whether I will not go into details. 1 million individual meals since the second week of April are being prepared daily. So according even to the UN, we have daily 680,000 people which depend on these daily meals, and they represent about 30% of the population, 35% of the population. They do not have access to the daily meals since the second week of April. The food security sector also emphasizes that one cooked meal per day, one cooked meal for 1 million people, is far from sufficient to meet a person's daily minimal caloric intake and dietary diversity needs. So we are talking about 1.68 million people on the Gaza Strip that are either receiving no daily food from aid organizations, or the amount that they are receiving is not enough to cover their daily minimum caloric intake and dietary diversity needs. If we go further to malnourished children, according to the health ministry in Gaza, and this was last week, we are expecting this figure to be even more this week. 60,000 children already need treatment for malnourishment. In March alone, which we are talking about 3 weeks ago, 3,696 children were newly admitted for acute malnutrition out of 91,769 children screened. So in March, when the community kitchens were operational, when the distribution was ongoing, 4% of the children in Gaza had to be admitted for acute malnutrition. Now we are 3 weeks after that. The numbers of April are worse as food is running out. Amjad was very clear about it, and the UN is also clear about it. 92% of children between 6 months and 2 years are not receiving sufficient dietary requirements, according to the United Nations. 92% of breastfeeding mothers are not receiving their dietary requirements. When we are talking about 92% of children and 92% of breastfeed in this age group and mothers, this is disabling the children for life. When not receiving at this critical age enough dietary requirements, you are talking about stunting, you are talking about decreased growth rates, you are talking about health complications, you are talking about disruptions to the growth of the neurological system in the human body. This cannot be emphasized. In March, the number of children who received blanket supplementary free feeding, and this is in March, we're talking about 3 weeks before, medium quantity lipid-based malnutrient supplements decreased by more than 70% from 84,000 children to only 22,000 children. This represents less than 10% of the nutritional cluster's target of all 290,000 children between 6 and 59 months, between 6 months and 59 months. So we are talking about that in March, only 10% of the children that are targeted for supplementary feeding were reached. Now we are talking in April, and we are talking that these programs have mostly shut. Non-trauma related death. The health sector has been devastated. Non-trauma related deaths is an important indicator for famine, but it's not being reported because we have several reports, many reports of people burying loved ones and neighbors that die without injuries and trauma, without going to hospitals, for difficulty of access, for the destruction of the hospitals, destruction of the road systems, and people are too frail and too tired to go to these hospitals and to these health centers. So, what is needed in this context? As it's evident for everyone, every major indicator of the 3 indicators of famine has been surpassed, or we are not able to measure it currently because of the Israeli destruction of the health sector. But it's quite reasonably that these have also been surpassed. So when we are describing that the situation in Gaza is famine, it's famine situation. It's not famine-like. Even when talking to reporters, health workers, humanitarian workers in Gaza, they would even themselves describe how the hardship they are facing every day, more and more, of course, to get and guarantee enough food for themselves, even as people that are working in the sector. What is needed right now is to guarantee humanitarian access. And the Israelis are quite frank about it. The Israelis have said openly, and this is widely supported, and the Israeli Supreme Court also backed up the Israeli government and army on this, that they are using humanitarian aid as a weapon. They are weaponizing starvation, famine against the Palestinian population. This is coupled with the deep environmental pollution that Amjad has talked about, the accumulation of waste, the accumulation of pollutants, the inability of the health sector to address the chronic need of the population, and also the deterioration of access to water. 65% of the population in Gaza doesn't have access to the minimum required by the UN in emergency situations of 15 liters of water per day. They only have access on average to 6. So we are 6 or below, not on average, 6 or below. So we are talking about a dire situation. This puts immense responsibilities on countries because the Israeli government and the Israeli judicial system have proven, especially with the decision of the Supreme Court, to not compel the Israeli army to allow aid in, and with Israel's Minister of Security, Israel Katz, saying that he will not allow aid into Gaza, that if they want aid, they should reach a deal, the Palestinians, which traps the entire civilian population between the hammer, I would say, of the Israeli occupation and the fact and reality that they have no choice and no ability to do anything to influence the situation that they are currently in right now. This puts direct responsibilities on countries to stop arms transfer, but also to deploy an international peace force, which Bingo has publicly called for in statement, to guarantee the protection of civilians and the opening up of humanitarian corridors to allow in food, medicine, but also professional personnel, medical and relief personnel, to help relieve the humanitarian situation in the Gaza Strip. I will stop here and open up the floor if we have any questions or comments from any of the people that have joined us, either for me or for my colleague Amjad from Gaza. Okay, if there are no comments and no questions, I would thank everyone who attended this briefing, and would encourage anyone if they have any questions, any statements, to reach out to me or to my colleague Amjad. Amjad, if you want to have the closing remarks.
I think Isabel, she raised her hand, I think. So, Son, thank you, Ubay, and thanks everyone again for your attendance. Thanks, we're counting time in Gaza by seconds in such unpredictable situation that we are living in. And let's wish that we will have a ceasefire soon and to reopen the crossings. But it looks that the Israelis intentionally want to continue this humanitarian complicated situation forever and to make Gaza unlivable place. So we are rely on the people steadfasting on the sumud of our people, and at the same time, friends all over the world. We believe that still there is some space of hope that there will be action to be taken to pressure to save the lives of these children, women, elders, these brilliant youth who are seeking to reconstruct Gaza, which is part of the Palestinian territory. So I think solution can be made and pressure could have impact if it will be done as soon as possible. Thank you and best wishes to everyone.
Okay, thank you, Amjad. And thank you all for attending. We will send an edited recording of the session with the Bingo statements. Thank you.
Thank you.
Thank you, Ubay. Thank you, Amjad. Highly appreciated.
Thank you.
Thank you very much.
Thank you.